Hi everyone, it is Dr. Richardson and I am back with chapter 15. I'm going to go ahead and share chapter 15's PowerPoint. As always, please remember that to read your chapter, your textbook, as this PowerPoint and this lecture is supplemental to your textbook. So just please make sure that you are still reading and continue to read your textbook, as you will find a lot of uh, content within your textbook that may not be covered within the PowerPoint. As always, if you have any questions, please do not hesitate to reach out to me. So let's get started. So chapter 15, we will be talking about the nature of middle adulthood, physical development, cognitive development, careers, work and leisure, religion, spirituality, and meaning in life. So again, the nature of middle adulthood topics, changing midlife. Of course, there are many different changes that occur during midlife and in defining middle adulthood. So let's go ahead and get into changing midlife. So many of today's 50-year-olds are in better shape, more alert, and more productive than their 40-year-old counterparts from a generation or two earlier. So as adults become older, their age identity is younger than their chronological age. And an increasing percentage of the US population is made up of middle age and older adults. Although there are great positives to this stage of life, many physical aspects of life decline and rates of health problems increase. So let's define middle adulthood. So middle adulthood is the developmental period for adults ranging between 45 years of age to 65 years of age. For many, it is a time of declining physical skills and increasing responsibility, greater awareness of the young old, and the strength amount of the time that is left in life, seeking to transmit something meaningful to the next generation. So they're looking to try to um, transmit something that they have in that they have learned and instill it into younger generations, and then reaching and maintaining career satisfaction. So they're looking to go ahead and reach their highest level of satisfaction within their careers. All right, so within late midlife, between 55 to 65, this is likely characterized by a death of a parent, the last child leaving the parental home, becoming a grandparent, preparation for an actual retirement. So there's a lot of positives and there's a lot of negatives that are characterized within the late midlife between the ages of 55 to 60. So the concept of gains, which equates to growth, and losses equate to decline, is important to the field of lifespan development. So as I have mentioned in mental adulthood, gains and losses, as well as biological and social cultural factors, balance each other out. So let's talk about these physical changes. So physical changes are a key aspect of middle adulthood development. And then there's chronic disorders. They may be more prevalent during middle adulthood. Mortality rates are important consideration in middle adulthood. They provide insight into health trends and life expectancy for this age group. And then sexuality remains an important aspect of life in middle adulthood. It can be influenced by physical and psychological factors during this stage. So some visible signs of physical changes include age spots, hair thins and grays, teeth yellowing, nails thickening, becoming more brittle, and then of course the skin wrinkling and sagging. Since a youthful appearance is valued in many cultures, individuals in this period may strive to make themselves look younger. Continuing on vis- physical visual changes, individuals lose height and gain weight. Obesity increases from early to middle adulthood, and then changes also occur in strength, joints, and bones. Vision and hearing is also a big change. The combination of the eye, the ability to focus and maintain an image on the retina, and it declines most sharply between the ages of 40 and 59. So in particular, people begin having troubles viewing close objects. Hearing can start to decline by age 40. High-pitched sounds are typically lost first. And the cardiovascular system, high blood pressure, high cholesterol, cardiovascular disease increase significantly within this age group. So it is linked to weight gain between ages of 45 and 60, linked to an unhealthy diet in adolescence. So again, we want to make sure that during adolescence that teenagers are practicing safe and healthy diets because it is linked to adolescence, or it is linked to adulthood. And then social economic status factors play a role. The lung tissue becomes less elastic around age 55, decreasing lung capacity. And then sleep, 8 hours of sleep or more are necessary for optimal performance the next day. Chronic disorders are characterized by a slow onset and a long duration. This is rare in early adulthood, increase in middle adulthood, and become common in late adulthood. Overall, arthritis is a leading chronic disorder in middle age, followed by hypertension. Men have a higher incidence of fatal chronic conditions. So it's important that during this time period or this developmental stage, that adults continue to go to the doctor and make sure they are taking preventive treatments and taking preventive steps to avoid these chronic disorders that may lead to mortality. Okay, and then we talk about mortality rates. Main cause of death, chronic diseases are now the main cause of death for individuals in middle adulthood. So, and then there are gender differences. Men have higher mortality rates than women for all the leading causes of death. Cancer continues to be the number one cause, followed by heart disease. Sexuality, we talk about sexuality, menopause, which occurs in women, cessation of a woman's menstrual periods, usually during the late 40s and early 50s. Late menopause is linked with increased risk of breast cancer. And the loss of fertility is an important marker for women. So the menopause, production of estrogen by the ovaries declines, producing uncomfortable symptoms in some women, such as hot flashes, nausea, fatigue, and rapid heartbeat. Cross-cultural studies reveal these symptoms are not universal. So we have to look into genetics, diets, reproductive, and cultural factors, which may be involved to kind of understand why cross-cultural studies indicate that these symptoms aren't universal. So hormonal changes in middle-aged men, most men do not lose their capacity to father children. There is usually a modest decline in sexual hormone level and activity. We have erectile dysfunction, which is an ability to achieve and maintain an erection, affects about 50% of men 40 to 70 years of age. The main treatment for this is Viagra or similar drugs. So frequency and interest, sexual activity occurs less frequently than in early adulthood. Living arrangements, living with a spouse and partner makes a difference in terms of engaging in sexual activity, especially for women over 40. And then a person's health is also a key factor when we talk about sexuality. And then cognitive development, we also talk about this in chapter 15, which includes intelligence, information processing. So intelligence is a key aspect of cognitive development in middle adulthood. This topic explores how intellectual abilities may change or remain stable during this life stage. And then information processing focuses on how these individuals perceive, store, and retrieve information. So fluid and crystallized intelligence. So when we talk about crystallized intelligence, this is the accumulation of information and verbal skills. It continues to increase in middle adulthood. And then fluid intelligence, this is the ability to reason abstractly, may begin to decline in middle adulthood. Again, these are some studies here that you can read up on in your textbook. When we talk about information processing, one of the key points is speed of information processing. So there has been studies that perceptual speed begins to decline in early adulthood and continues to do so in middle adulthood. A common method of assessment is the reaction time task. So middle-aged adults are slower to push a button when a light appears. And then research on possible causes involve different levels of analysis. Memory. So most experts conclude that memory does decline at some point during this period of adulthood, adult development. Denise Park argues that in middle age, more time is needed to learn new information. Memory does decline and is more likely when an individual does not use effective memory strategies, organization, and imagery, for example. Practical problem solving. So you see during this stage, you may see puzzles, with crossword puzzle things such as that. Everyday problem solving is another important aspect of cognition and improves between early adulthood to middle adulthood with the accumulation of practical experience. And performance begins to decrease at about 50 years of age. So then we get into career, work, and leisure. So work and midlife. So work and midlife is important, and it's characterized by career stability and expertise in one's field. These individuals may face various career challenges and changes such as job transitions, skill updates, and consider new career paths. And the leisure activities play a crucial role in maintaining work-life balance and overall well-being during this stage of development. So again, the role of work is central during middle adulthood in the United States. About 80.6% of people aged 45 and 54 years of age are employed. For many, midlife is a time of evaluation, assessment, and reflection about work and what they want to do in the future. Premature retirement due to economic downturns and recession can result in insufficient resources. So here are some challenges and changes. So rapid developments in information technology, downsizing of organizations, early retirement, concerns about pension and healthcare, and then some are self-motivated. The career changes, some are self-motivated, others are the consequence of losing one's job. So lastly, we talk about religion, spirituality, and meaning in life. So religion is a organized set of beliefs, practices, rituals, and symbols that increase as an individual's connection to a sacred or transcendent other, participating in prescribed rituals and practices, feeling a sense of connection with its beliefs, involvement in community or community of believers. So spirituality, the practice of experiencing something beyond oneself, interested in matter. So living in a way that benefits others in society. So in 2020, individuals support religious affiliation has decreased to just 47%, representing less than half of the adult population for the first time since the question was asked more than 80 years ago. Women have consistently shown a stronger interest in religion and spirituality than men have. And then potential health risks, some cults and religious religious sects tend to encourage behaviors that can be damaging to health, including ignoring medical advice. Positive health links in the religious mainstream, however, religion appears to be positively linked to health. And then various dimensions of religion and hoping to help some individuals cope more effectively with challenges in their life. And then meaning in life, during this time frame, individuals are looking to find or find a need for purpose, need for values, need for a sense of efficacy, and need for self-worth. Individuals who find a sense of meaning in life tend to be physically healthier and happier. So that concluded chapter 15. I know this was a quick lecture for you. You are free to go and review these slides at your convenience. Also, do not forget to go back and read your chapter 15 textbook. If you have any questions about the content, or anything that I have mentioned within this lecture, please do not hesitate to reach out to me. I hope you have a great week and I'll see you next chapter.